All right. So we're going to continue with discussion of joints and joint types, and then some about fractures. We're getting pretty close. We're getting pretty close to the close of this. So talked about yesterday. This would be like fibrous joints would include sutures, like in the skull, and syndesmoses, like at the base of your tibia and fibula, where they're held pretty firmly together. Not a lot of allowance for movement. There's that picture, and I think we ended pretty close to here. We talked about cartilaginous joints, and what do we call those cartilages that are between? Let me show you this. But what do we call these cartilages that are between your vertebrae? What are those referenced as? Well, if it gets out of place, what do you say? Somebody's got a problem with the disc, right? Okay, so that's where we left off writing-wise. So now synovial joints involve more freely movable joints, and we said yesterday that what would be an example of a synovial joint? We know for sure. Yeah, right. Where the head of the femur fits into the acetabulum of the coxal bones, and we know that because when we watched the surgery about hip replacement, it referenced that synovial fluid, that synovial capsule being ruptured, and that synovial fluid leaking out. And one of you, I think, even asked maybe what happens to restore that. Although I suppose you have different surfaces. It's not living surfaces that are against each other. So it'd be a little bit different situation. Maybe that, I don't know that capsule does get restored. Maybe it doesn't. Okay. Fix anything. You got a squeaky hip joint. Okay. So here are those synovial joints. One of them is showing the joint of the shoulder in F, and then G is showing the joint in your elbow, and then H is showing the joint in the bones of your wrists. Okay. So what are some features of that? Well, we have articular cartilage, and what we mean by that is the articular surface is the part where it comes together. What do we call that articular surface, for example, of our knee? Elena, you want to give that a try? What do you call that, the cartilage that's on the articular surface of your knee that can sometimes get torn?
Oh. Heard of this. I don't remember.
You guys? In young people, it can be repaired sometimes. In older people, it's not as vascularized. Sometimes it's harder to repair. Sometimes they just trim up the edges to keep it from being catchy. Meniscus.
Oh.
It's a meniscus. Okay. And then there's a fibrous articular capsule that encloses the joint surfaces. And that joint then is filled with synovial fluid, as we said. And then ligaments reinforce that joint. So basically we're saying it pulls it into place. Because if we look at the knee of the skeletal model over here, mostly these are just pushed together, right? That there isn't a socket. Your knee doesn't, your tibia doesn't really fit into a socket in your femur. They're just pulled together, and they're pulled together with connective tissue, particularly ligaments, a whole series of which are involved there. And we actually have that model of that here. So um, we have an anterior cruciate ligament. Okay, that's this one. Okay, that's this one, anterior cruciate. And then we have posterior cruciate, which starts in the back and crosses the other way. I'm upside down here. The anterior cruciate, posterior cruciate, see them as well. And then this one that's on the outside, or excuse me, this one that's on the inside would be the inside MCL, medial collateral ligament. And this one that's on the outside would be the LCL, lateral collateral ligament, right? And these are, and then it shows these pads, show that, these guys. So we have all these ligaments. The ones that crisscross in here are cruciate. And so it's the same root as crucifixion, right? So it means cross. So they crisscross. That's why they're called cruciate. And then this would be medial collateral and lateral collateral. Okay. And so that's what holds the knee in place. And then these pads, what are these pads called? Just said it, guys. We just said it. The meniscus. It's the meniscus. Okay. All right. So there's a link there to an ACL replacement surgery, which, by the way, do you know how they did your previous one?
They did it with my patella tendon.
Oh, they did.
And
Okay.
the next one will be with hamstring.
Okay. So those are both fairly common. I think, I don't know. I'm speaking just from having talked to students and stuff that have had it, but I think historically, your patellar tendon was used, people's patellar tendon was used more often. And now I think the more common repair is with a hamstring. All right. No, not right now. Okay, so bursa is a flattened fibrous sac that lines the synovial membrane. Have any of you ever heard of that? If that gets inflamed, what would be a good name for that if it gets inflamed, James, or gets irritated? The bursa gets irritated. Anybody ever heard of bursitis? Maybe you've never heard of bursitis. Anybody ever heard that term? Hey. My dad, when we were stacking hay and he was running a loader tractor all the time, he was up above his head and doing this all day long. And he would get, I don't know how much of a medical background he had, but he self-diagnosed that he had some bursitis in his elbow. And he may well have, I don't know. But anyway, it's when that bursa sac gets irritated or inflamed. And so on this next slide, we'll take a look at the picture of that, and particularly that your shoulder joint where your humerus articulates with your scapula and clavicle. And that kind of a fluid-filled bursa, it's meant to kind of reduce the friction in the joints. Well, you can imagine if you just had a dry tendon that was stretched over a bone that was getting bent over and over again, that it could irritate and wear it out pretty quickly. Instead, there's this kind of a lining, that's the bursa, that's meant to reduce some of that friction. So here's what that looks like. Again, this is the shoulder joint. So here's the bursa. Okay, here's the tendon sheath, both of which have kind of fluid in them and are meant to reduce friction. This is the joint that's containing that synovial fluid, lining that. Again, here's the bursa that's kind of padding that. Okay. And do you remember in the video, the hip replacement video, he talked about we're already into the joint capsule here. And so it's talking about this fibrous capsule that kind of surrounds the joint. All right, so here are some ways that things can bend. So this is a plain joint in the carpals. It allows for this kind of movement, okay? And then the next one's more obvious. A hinge joint just allows in one plane this kind of movement. And then pivot that's the foosball playing type of motion. And so those are all, this is hand, this is elbow, this is also elbow. But you really have, and when we talk about muscles, we'll talk about how that works. Because, for example, when you're doing this motion, you don't really normally want this to happen at the same time. So there'll be muscles that will stabilize the joint, keep it from twisting so that you can just lift this way. Or if we're only interested in doing this, there might be muscles that stabilize the hinge portion so that we can just focus on that rotating movement of the pivot portion of the joint. A condyloid joint. This is showing like the joint between your fingers and your metacarpals. So it's showing that you can move it in a number of directions there, and you see that in this diagram showing this. Then a saddle would be, this is talking about your thumb, only this kind of, the way that it fits in there is a little bit different motion. Opposing thumb, that's how you can taunt other mammals. You can't do that. Okay. And ball and socket, that's that full range of motion that you have. Okay. By the way, those of you that are watching, I'm being mocked over here. There's mockery happening. But I'm gonna just rise above that. Let it go. Okay. So bursitis is inflammation of a bursa by a blow or friction. So repeated movement or some kind of an impact that actually causes damage to that bursa sac. Tendinitis, inflammation of the tendon sheath. Anybody know what you call it if you have a lot of tendinitis in your elbow? Say it. Tennis elbow, right?
Oh, yeah.
Any of you ever had tennis elbow? I always thought that's ridiculous. That doesn't even seem like a real thing. But it was really odd, probably 10 years ago. And oddly, I was actually playing some tennis, not very well and not very much. So I don't really think that's what irritated it, but that's how I found out about it. And it was really, it wasn't unbearable, but it was quite uncomfortable. Anyway, so tendinitis. And if any of you, probably all of you a little bit, when you were growing particularly, had some patellar tendinitis. Any of you had that? Pain in your knees? Your parents probably just said, oh, you said kind of growing pains or whatever, which is true, right? But one of the things that they could do to relieve some of that pain from patellar tendinitis, have you ever seen people wear these band things that go right around that part of their knee? Yeah. Did you have that one time? Okay.
No, I think Will did.
Yeah, Will did, and I think Logan Weiner might use that now something. But anyway, for whatever reason, having a little tension going perpendicular to that tendon somehow is helpful. So they make a kind of a band that goes across that. But all those are kinds of tendinitis. Arthritis is an inflammatory or degenerative disease. Lots of different types of arthritis, but there are 2 or 3 major categories. We're going to talk about 3, I guess. One's just the kind that everybody, if they get old enough, their joints start to ache and they get irritated and stuff like that. what's that called? Just means bone joint irritation. What's the prefix that means bone? Osteo. So that's called osteoarthritis. And then the kind that's actually an autoimmune disease where your body is attacking your own joints and can cause these kind of gnarled fingers. Have you ever seen where somebody's hands are really deformed? Some of you have. Anybody know what that's called? That's called rheumatoid arthritis. Anybody ever heard of somebody having rheumatoid arthritis? It's a fairly common malady. And then there's another one that has to do with joint pain that's related to, sometimes it's triggered by diet, and much more common in males. Not really sure why that is. Anybody ever heard of that? People have really severe pain in their knees or toes. Oftentimes it irritates people's big toe. You ever heard of? I bet you have. When I say the word, I bet you say, "Oh, that." Anybody ever heard of somebody having gout? Gout is actually gouty arthritis. Well, you guys can ask your dad sometime. Ask your dad if they know of anybody that's had gout, and probably there's a fair chance they've had experience with it. But oftentimes it can be controlled by diet. Things like, I think, shellfish are bad for it. Sometimes maybe pork is kind of bad for it. Anyway, so we have osteoarthritis. Osteo is the most common and chronic, normal aging. If people live to be old enough, they'll have some degree of joint pain due to osteoarthritis. Rheumatoid, as I said, is an autoimmune disease. That is, your own immune system attacks the joints, and that can lead to those deformities. Maybe people's toes cross or their fingers become misaligned, things like that. I think we're going to be able to close it out today, guys. We're really going to finish strong here. Helena doesn't feel it. My first impression was Helena was not that excited about that prospect. And I think I have a model of a hand, the one that I showed you before. Thank you. Heaven sakes.
Times 3.
Pull something. This model is meant to show deformities that can happen in the joints. I don't know if there's anything especially enlightening about it, but you can hand that around. You can. Okay. So, gouty arthritis. Gouty arthritis, inflammation of joints caused by uric acid crystals. And if you do a little bit of asking to middle-aged and older guys, mostly, somebody that you visit with is going to say, "Oh, it's terrible. It's extremely painful," all of that kind of thing. It's it can be really debilitating. But it also can be relieved really quickly. Okay. So those are common types of arthritis. Again, so there are many other types. That those are the three that you ever hear referenced by people. But I suppose there's slight variations of all of that. Okay, then developmental aspects of the skeleton. So shrink that down a little bit. At birth, the skull bones are incomplete. That is, there are gaps in them. We looked at this once before. They're joined by membranes called fontanelles. And what do we call those in a baby? A baby's skull has soft spots, right? But that's what they are, is those fibrous connections. They're completely replaced with bone within the first couple years from birth. Okay. What's kind of interesting is that when we look at these, when we look at the fetal skeleton, you would think that the joints would, the articulations would develop early and maybe then the shaft of the bone, but it's really quite the opposite. The bone starts to develop more kind of in the middle and extends out until the epiphyses are articulating with the adjacent bone. But I think that also speaks to, we talked about before, a baby has extreme flexibility, right? I mean, they're living those first few months in a pretty tight spot, and it's advantageous for both the survival of the mother and the child for them to be able to be kind of contorted as they're delivered. So if we look at this, so here you see, like, this is the tibia and femur, and the knee, there's really no bone at all right there in the knee yet. Okay. Likewise, in the shoulder, you have the humerus here and the scapula developing, but there's really no ossified bone in the actual shoulder area. Elbow, same thing, right? Look how far away the radius and ulna are from the distal head of the humerus, right? So, I mean, that if you've been around babies much, they're very flexible and all of that, but they don't have even at birth, those bones maybe haven't completely articulated. Okay, so long bones are formed from hyaline cartilage. Flat bones start out as fibrous membranes. Flat and long bone models are converted then to bone. So they start out cartilaginous or fibrous and eventually become ossified. They become bone. Next thing that's kind of interesting, I think, is that head size, adult head size, is achieved pretty early in life. So if someone's going to have a fairly large head, it looks very much out of proportion when they're little, because it's pretty close to adult size maybe not entirely, but quite close to adult size, and it's being carried around on this little 8 or 9-year-old kid, right? And a lot of that head size and all that's pretty much genetic. Um, are you ready? Okay, this is a lot. But in adolescence, the epiphyseal plates become ossified in long bone growth ends. Talked about that a number of times. If you ever had an x-ray as an adolescent, they probably commented somehow or another on how much of an opening there were in your epiphyseal plates or growth plates. And if those are closed up, then you're pretty much full size, however big you're going to get. Size of your cranium. At 2, the skull is significantly larger in proportion to the body. So the ratio of head size to body size is a little higher for a little tiny child. Then even by 8 or 9, as I mentioned before, the head size is nearly adult size, and of course your body is far from that at that age. Then from 6 to 11, and this next slide is going to kind of show that, but in a small child, the jaw kind of slopes back, so that the forehead and nose area are kind of the prominent parts that are forward in the skull. But eventually, the jaw kind of moves out and forward, and so that's when someone starts to look more like their adult self. There's only 2 more screens, actually, guys, of writing. The other parts are just pictures. So I think that's good.
No more writing.
2 more screens. 2 more screens. Finish strong, Kai. All right. So here's that image of how a newborn's face kind of morphs into what their adult head shape and face shape is. I don't know what the grid over the top really does for us, but it's meant to show. I mean, look how recessed the mandible is on the newborn, and then the adult, that jaw grows out and away. Okay. All right. Now, we talked about before when we were talking about the spine, we talked about conditions, primary and secondary curvatures of the spine. So remember the picture I showed you then of the baby that had just kind of a perfectly arched back? They had a baby lying on someone's forearm with their back up in the air, and it was just a perfect curve right from the base of their head all the way to the top of their bottom, so to speak. And it was just a one continuous curve. Well, eventually we have some inward curves. And what are the inward curved parts of your spine, Chloe? Where does your spine curve inward? If we divide your spine into basically 4 parts, where are the 2 parts that are curved in? Your neck, right? I mean, feel how if you do this to yourself, you can feel how your neck cups in, can't you? from the base of your head to your shoulder blades, it curves in. Where else is there an inward curve, Helena? Yeah, the lumbar, your lower back. In fact, some chairs and car seats and all that kind of stuff are made to have kind of a pillow or a support that fits into that curve. Question becomes, why do we have a curvy spine? Why don't we just have a rigid, straight spine? James?
Is it because we used to walk on all fours?
Because we walk upright, we have to be able to keep our weight over top of our feet. And by having those different sections of your spine that curve different ways, we can do these constant postural adjustments and stay upright. Okay, so primary curvatures at birth are convex. That means that they curve out. We're going along the back of a small child, an infant, it would just be a perfect curve. As I said, from the base of their head to the top of their bottom. And then those secondary curvatures associated with later development, and those are inward curves. And abnormal spinal curvatures, we looked at this before, nothing to write here, but just look at it. So what three ways could our spine be kind of deformed? I mean, without getting too creative, we could have a kind of a exaggerated curve at the top of our shoulders, right? We all seen people that like that. We could have an exaggerated inward curve in our lower back, or we could actually have a lateral curve. Anybody know what that's called? I think I asked you this if they look at this when they do health screenings here at school. Elena, that's scoliosis. Scoliosis is a curve that goes in the other direction. So scoliosis is this kind of side to side curve of the spine. Okay, kyphosis is this exaggerated curve in the kind of the exaggerated outward curve of the thoracic vertebra. And then lordosis is this exaggerated inward curve of the lumbar vertebra. Okay, this is it. Osteoporosis. What does it mean literally, Kai? Osteoporosis. Well, what does that word mean? Porous. What does it mean if something's porous? Maybe, not strong. Porous, full of holes, right? Or something, literally, it means it's full of holes. So a piece of plastic sheeting wouldn't be very porous, but a piece of cotton cloth would be porous. It's got holes or gaps in it. And in the case of our bones do have openings in them, but if those get too expanded, it obviously weakens them significantly. So disease can cause thinning of bones. There are even certain types of it. I can't think of any particular examples, but over time you hear things that maybe long-term treatments that people are on that can cause damage to their bone density. And if you remember the doctor on the hip replacement surgery, what were his comments about the patient's bone density? Yeah, it was pretty good. So that would be more problematic if you were drilling in and trying to open up the acetabulum and that coxal bone was really thin and osteoporotic. And also here it talks about vertebral collapse results in kyphosis, also known as Dowger's hump. So if you're familiar with some people when they get older, they get a very extreme kind of hump in their shoulders. It's fairly common, but it's really a sign of osteoporosis. Like in my dad's family, the women, one of his sisters and his mom, I mean, they couldn't hardly look up. I mean, their upper back had collapsed to such a degree that they couldn't hardly hold their head up. And so it can be quite damaging. So here's what osteoporotic bone might look like. We looked at normal bone on the right and osteoporotic bone on the left. It's just gotten thinner. All these bars of bones that are between these normal kind of pores have thinned and thinned. So that's what osteoporotic bone would look like. Okay, so for next class, you need to answer. We didn't grade those next few pages, but we can finish now. We're all the way through, so you actually should be able to finish from page 22 to 28. Finish from 22 to 28.
15 is